So as we think about surgery for knee replacement, if you're a candidate for the outpatient setting, we know it's a same-day discharge, right? So no overnight stay in the hospital. And what we've seen is that this can be done safely with the same outcomes of keeping you in the hospital. The recovery and what you expect to have happen for you in that first 24, 48, 72 hours, for a large majority of patients, you don't need to be in the hospital for that period of time.
I was having trouble going up and down stairs. The knee would hurt, and occasionally it would, you just didn't want to put any weight on it.
So Jim's the perfect candidate for same-day discharge. And first and foremost is probably his own motivation and understanding of the procedure. His health status is appropriate, meaning he doesn't have a long list of medical conditions, and he had the appropriate support structure.
I went in early in the morning, they did the operation, and I was home that night.
As we're talking to you about doing your surgery, your knee replacement here in Arringdon, you've probably seen us already in the 3rd floor in the clinic to plan this. You'll go to the 5th floor for your surgery, and after you've recovered appropriately, we actually have you just go down to the 2nd floor, same building. And that's where the physical therapists work with you to make sure that you're ready and safe to go home. And once you've cleared PT, they'll just take you down one more floor and out to your car, and you'll head on home.
I'm still going once a week to physical therapy to increase the range of motion and get my the weight bearing and muscle toning back to normal. We do a lot of gardening, and so all the spade work was difficult. And I've been doing a lot of that since the operation. So we've done a lot of planting, moving bushes around. Every time I go to the physical therapist, they say, "Wow, you were already here, right?" And so I know I'm right on schedule.